There was a lot in the news last week about a new treatment for endometriosis. Let's talk about it. The pill is called Ryeqo, and excitingly last week it was approved by NICE to be used on the NHS. But it's not a new drug. Actually, it's been around for a little while and had been used and approved for the treatment of moderate to severe fibroids, but also for symptomatic treatment of endometriosis in women with a history of previous medical or surgical treatment by the European Medical Agency back in 2023. Alright, in super simple terms, Ryeqo works by blocking hormones that contribute to endometriosis while also providing necessary hormone replacement. Now, in order to understand how Ryeqo works, you need to understand the basics of how reproductive hormones are released. Stay with me, I will make this fun. Going back to basics, the part of the brain called the hypothalamus releases a hormone called gonadotropin releasing hormone, or GnRH. It does what it says on the tin. It stimulates the pituitary gland, which is also in the brain, to release gonadotropins called FSH and LH. Now, gonadotropin, gonado meaning gonads or reproductive organs, and tropin meaning stimulate, these hormones literally stimulate our gonads, that is the ovaries in this case, to release sex hormones, estrogen, progesterone, and testosterone. Are you still with me? All right. Endometriosis is estrogen dependent. And so if we reduce the amount of estrogen, then it should help with symptoms, right? Now, Ryeqo has 3 components: relugolix, estradiol, norethistone acetate. The relugolix is known as a GnRH antagonist. So imagine these are GnRH receptors and this is GnRH. GnRH binds to the receptors and they stimulate the pituitary to release FSH and LH. But relugolix can also bind to these receptors and basically block the natural GnRH from binding and working. So the pituitary stops producing FSH and LH, and in turn, the ovaries also stop producing sex hormones. So estrogen levels drop and the symptoms of endometriosis should also ease. But remember, doing this will plunge the body into menopause and the symptoms that come with it too. And this is where the estradiol and estrogen and norethistone acetate or progestogen in Ryeqo come in. They help to combat this, and this is known as add-back therapy. They're also in low doses to prevent menopause-like symptoms without triggering the endometriosis growth. This medication being available on the NHS now is great news, as it's an additional option for those who've had other treatments that have either failed, been intolerable, or unsuitable. Roughly around 1,000 patients a year will benefit. However, every medication has its side effects, so it's important to remember that these can still happen. So, is it a cure for endometriosis? No. We still need more research for this.